Welcome to Parallax, where we look at life from how we work. Joining us today is Dr. Rachel Smolowitz. Dr. Smolowitz is a clinical psychologist at a drug treatment facility. She sees patients who are both battling addiction as well as reclaiming their lives after having come clean. Dr. Smolowitz, welcome to Parallax. And if you could walk us through what a typical day looks like in the life of a clinical psychologist.
Sure. I work with a lot of clients. Usually I will see people all day long and do a bunch of paperwork as well. That's the unglamorous side. Maybe do some case management work with people to help them find resources that they need. Usually when somebody comes in my office, some of the things I'm thinking about are what they need to address today in session. It might be something like what has been going on the past week for them. It might be something that they're frustrated with right now, or it might be something related to their goals.
So it sounds like you're saying come into your office. Are these outpatient or inpatient?
I mostly see outpatient people. Usually it's people who have gotten a good start with inpatient substance abuse treatment, and then they're continuing their substance abuse treatment work. And so people who have depression or anxiety or something like that, as well as their substance abuse, which most people do, will also come into my office and meet with me.
How many patients do you see?
It varies a lot. Right now my caseload is actually pretty high. It's about 45 people. A couple of them are inpatients, so I see them usually 2 to 3 times a week, a lot more frequently than my outpatients. My outpatients I might see once a week or every other week or even once a month sometimes. So at any given time, I'll see a very different frequency of people based on how well they're doing. So
what substances are people coming in for treatment for? Is there an overarching theme to the addictions in this area?
So particularly in Baltimore, we see a lot of opiate and heroin addiction. Heroin would be an opiate, but we also see opiate pill addiction. And then we also see, especially with our adolescents and young adults, some severe marijuana abuse. So that it's not just kind of smoking every once in a while, but all day, every day, and instead of going to school or work. Is there a difference in how an addict manifests, whether it's heroin or pill addiction? Well, sure. Especially in our younger population, again, adolescents and young adults, a lot of kids will start out with their grandparents' pain pills that they might have because of whatever physical illness that they have that they may be managing fine. They'll try out some pills, they may try them with their friends and things like that. Sometimes that will bring them to a heroin addiction because heroin is cheaper to get, it's sometimes easier to get, and it has a more intense high for people that are very addicted to it and kind of will develop a tolerance to a lower amount, so they keep on trying to get more and more. So and then with the marijuana, is this more of like a self-medicating thing for adolescents? I mean, you're seeing, it sounds like you're not treating necessarily the addiction, you're treating what I would presume to be the causes of addiction. Well, certainly. I work in, we have very much a team approach at the drug treatment center where I work, and so a lot of other people will be working with them directly with their addiction, and I'm going to be working with them more with their mental illness, and it might be what caused the addiction in some way or another. Usually not so directly, but sometimes we do see something like self-medicating, where somebody is feeling really awful, doesn't really have good ways of handling that awful feeling, and will go to drugs because that's kind of, they'll feel a lot better as soon as they take the drug. It's kind of a very quick short-term answer, even if they're then kind of skipping school or stealing things or causing all these other problems in their lives to get to that short-term answer. So talk a little bit about not just the treatment, but outside of the treatment facility. What are patients faced with? What issues are they faced with in their daily lives? There's certainly a lot that people have to go through, and this is part of why it's so important to continue with outpatient treatment after somebody does the inpatient. They're kind of protected in this bubble, and then they get out and they have to figure out where they're going to live. They have to figure out what their support network is going to look like, how to make friends with people who don't have substance use disorders too, and reuniting with their families who might have been really hurt in the process of their illness, or might even have their own substance abuse issues. I think a bigger issue is also the stigma, the societal stigma of substance abuse and of mental illness. So they might need to make sure that their job is going to work around their treatment, but then to tell their job that they have a substance abuse or mental illness, that might be problematic for them, and they don't tend to want to do that. So they might have to worry about how they're going to communicate that with their boss, if they're going to communicate it with their boss. There's a lot of stigma against people with substance abuse and mental illness. We certainly have views of what it means to be a person in active addiction, and I think that people have not as much developed ideas about what it means to be a person in recovery from substance abuse or in recovery from mental illness, meaning that they're working hard on maintaining themselves in a very functional way, even with, either a desire to relapse or symptoms that they may continue to have of their mental illness.
That was really interesting, Dr. Smolowitz. I loved hearing about what you do for a living, what you're passionate about. And thank you all for watching Parallax. We'll catch you next time. In the meantime, keep it between the white line and the ditches.